Mange is a skin disease caused by microscopic mites that live on and in the skin of dogs. It is also known as canine scabies and is highly contagious. Symptoms may include intense itching, red scaly patches, hair loss, and skin thickening. Treatment may include topical or oral medications, medicated shampoos, and other topical treatments. Early detection and treatment are key to managing mange in dogs. There are two types of mange that can affect dogs: Sarcoptic mange and Demodectic mange. Sarcoptic mange, also known as scabies, is a skin disease caused by the Sarcoptes scabiei mite. It is highly contagious and can be transmitted to other dogs, as well as to humans. Symptoms of Sarcoptic mange include severe itching, redness, and crusting of the skin. Affected dogs may also lose their hair, particularly on their ears, legs, and belly. The mites burrow into the skin and lay their eggs, which leads to inflammation and intense itching. In severe cases, the mites can also infest the ears, causing a thick, black discharge. Sarcoptic mange can affect dogs of any age, but it is more common in young puppies and older dogs. It can also affect cats, although it is less common. Treatment of Sarcoptic mange typically involves the use of medicated dips or shampoos, as well as oral medications. The environment, including bedding and carpets, should also be treated to eliminate any remaining mites. It is important to follow the veterinarian's treatment recommendations to ensure that all of the mites are eliminated and to prevent the mites from spreading to other dogs or humans. Demodectic mange, also known as demodicosis, is a skin disease caused by the Demodex mite. It is not as contagious as Sarcoptic mange and is more commonly seen in puppies and young adult dogs. There are two types of demodicosis, localized and generalized. Localized demodicosis affects only a small area of the skin, typically on the face or front legs. It is more common in puppies and young dogs and is usually not serious. Generalized demodicosis, on the other hand, affects the entire body and is more serious. It is more common in older dogs and dogs with compromised immune systems. Symptoms of demodicosis include patchy hair loss, redness, and scaling of the skin. The affected areas may also be inflamed and itchy. In severe cases, the mites can also affect the nails, causing them to become thick and deformed. Treatment of demodicosis typically involves the use of medicated dips or shampoos, as well as oral medications. Dogs can get mange by coming into contact with other infected dogs or by coming into contact with contaminated bedding or other objects. Mites can also be transmitted to humans, although it is not usually serious in humans. Sarcoptic mange is highly contagious and can be transmitted easily from dog to dog through direct contact or through shared bedding or other objects. Demodectic mange is not as contagious and is more commonly seen in puppies and young adult dogs. To prevent mange, it is important to keep your dog up to date on their parasiticides and to avoid contact with other infected dogs. Once again, if your dog has mange, it is very important to follow your veterinarian's treatment recommendations to prevent the mites from spreading to other dogs or humans. The veterinarian may recommend isolating your dog from other pets. You need to continue washing their bedding and toys frequently to eliminate any remaining mites. The treatment for a dog with mange will depend on the type and severity of the mange. It is important to consult a veterinarian for a proper diagnosis and treatment plan. For Sarcoptic and Demodicosis mange, treatment may involve the use of medicated dips or shampoos as well as oral medications. In severe cases, systemic treatment with immunomodulatory drugs may also be necessary. The environment, including bedding and carpets, should also be treated to eliminate any remaining mites. It is important to follow the veterinarian's treatment recommendations to ensure that all of the mites are eliminated and to prevent the mites from spreading to other dogs or humans. In addition to medication, supportive care may also be necessary to help the affected dog recover from the mange. This may include providing the dog with a comfortable and clean environment, as well as addressing any secondary infections or other underlying health issues. If you suspect that your dog has mange, the first thing you should do is consult a veterinarian for a proper diagnosis and treatment plan. It is important to determine the type of mange and the severity of the infection in order to determine the most appropriate course of treatment. While waiting for your appointment, you should take steps to prevent the mites from spreading to other dogs or humans. This may include isolating your dog from other pets, washing their bedding and toys frequently, and avoiding contact with your dog if you have a compromised immune system. It is also important to follow any additional recommendations provided by your veterinarian to help your dog recover from the mange. This may include providing the dog with a comfortable and clean environment, addressing any secondary infections or other underlying health issues, and giving the prescribed medications as directed. If you have any questions about pets, leave a comment below. Stay tuned for the upcoming video with more pet-related info.